It's time for Checkup with Dr. G.
Time to have a checkup with Dr. G. And Dr. G, I have to tell you, I might have a couple of pounds on me, but I see a lot of youth today that seem to be heavier than they should be. Is there a problem with our youth today and being overweight?
One of the things from a pediatric standpoint is that we've been talking about childhood obesity now for over 20 years. And it's been somewhat of a struggle to be able to find a program that actually works. So you can talk to families, you can talk about diet and exercise and all of those kind of things, but basically trying to provide some inspiration to children and to the families and to change their lifestyle is a very difficult thing to do. And so here we've come up with a very innovative program that deals specifically with childhood obesity, and it's had some profound success. It's very exciting. It was a result of a conference that I went to, and one of the problems is that there isn't a good program. And so a lot of teaching hospitals have focused specifically on the treatment of obesity and what are effective programs to treat it. And we took those ideas from big teaching hospitals from the conference. I brought them back to Great Falls, and so now we offer a very comprehensive obesity program here that's tied together with some other work that people are doing that provides success.
So at what point, what stage in the child's life should the parent become very concerned to say, you know what, I don't think the baby fat's burning off? When do we get into this? When do we get into this?
We see a lot of children that actually come in at 9 and 10 years of age that are being bullied, that are uncomfortable with their weight, and oftentimes it's a silent thing. They don't talk to their parents about it because they're embarrassed, and they don't share these things with their parents until later on. And so I think that's one of the problems why we have such a difficulty in treating it, because it's already a problem that's developed and it's gotten out of hand before we actually get to a point where we're treating the children.
So what do you start with first? You start with the emotional level first and get that under control, and then start working on the physical intake. How do we approach this?
Well, the program that we use, we deal with the kids that have the most profound level of obesity, and we use our electronic medical record to calculate their body mass index and go from there. And so once we identify those children that want to be in the program, we actually look at motivational interviewing. We also look at laboratory and medical type conditions and rule them out. And then we start them on a medication that has been used throughout the United States that actually helps them lose weight.
Well, we're actually dealing on several levels, educating the child, but also educating the parent.
And one of the things is that that's very important. And so bringing the parent into the picture and also motivating them and the child. And we find that sometimes with the treatment, they both begin to lose weight as a result of this.
All right, if you're a parent out there concerned, doctor, give us a number to contact you with, and let's start this program.
It's 770-3000. Call my office, and we're happy to sit down and talk to you about the program and the benefits of it.
Thank you, Dr. Garver.
You've been watching Checkup with Dr. G.
Premier Care Pediatrics, where your family comes first.